Hi, my name is Mitch Starkman. I am a sports and orthopedic physical therapist, and I have hemophilia. So let's talk. Hey everyone, two quick updates before we jump into today's video. Number one, we have a free giveaway today. If you head over to deskjockeyphysio.com/guide, you can download your 5-step guide of how to set up the perfect laptop home office, which you can do right here, okay? And number two, we are now offering online physiotherapy sessions for you folks out there. To learn more about that, head over to deskjockeyphysio.com/online, and we'll see you there. All right, otherwise, enjoy the video, guys. Thanks for watching. Okay, so our next question is, how do you know if you have a hemophilia bleed? This is a question that I'm happy to answer because it's something I struggle with a lot growing up. You know, I used to hide injuries from my mom. Nothing was worse than getting caught. It always felt like when I had a trauma or issue, and it was hard to know what was a bump and bruise and what was actually, in fact, a bleed. And over the years, I've learned this through my personal experience and then also through my training, of course, as a physical therapist. So there are a couple signs or things to watch for in this case. You know, first and foremost, anytime you bump something, you might get swelling or inflammation. But if you get a whole whack of it really quickly, that's a sign. It's super hot and warm, and it stays pretty consistent. And the third is firmness. So over the area, it actually will get firm and sort of taut, as opposed to if it's just a bit of a bruise or contusion, it might be soft and liquidy, but in a hemophilia bleed, the area actually gets quite firm, and when you press on one side, let's say on a muscle, it might actually come out or bubble out the other, and vice versa. And when you push it together, it might actually feel compressive or almost like it has nowhere to go. Whereas normal edema or swelling, you might be able to just fluidly move around quite easily. So you'll have this redness, this heat, and of course this hard fluid. Those are things you might feel or physically be able to assess in the area. So those three. Then in terms of it talks about how do you feel. So as the patient, how do you know? If you're a parent and you're talking to your kid, how do you know? Well, one thing is a general feeling of malaise or fatigue. The person might feel like they are just super tired. They just can't quite, keep their eyes open. They're yawning a little bit more than they might normally. Might feel a little bit cloudy. And the reason for that is your body is going haywire, trying to figure out what's going on and setting all of its resources towards this area to heal and give yourself the best chance of recovery. What that means is it leaves the rest of your body, like your brain, with a little less resources to work with, for lack of better terms. And so what that means is you might feel this fatigue or tiredness. I know myself personally, I actually tend to get dark circles underneath my eyes, and I don't know if that is across the board. I haven't seen that in many other folks, but for me, it's a telltale sign that when I was trying to hide something as a kid, my family would know that that meant something was going on for me. My body was sort of directing its resources elsewhere. The other thing that I think is something you can report on is a feeling of a stretch when you go to move, a deep, achy stretch when you go to move that muscle. So sticking with our analogy of, let's just say, using the bicep, with a pull of the bicep, you might have pain when you contract it, right? Pulling up, I might feel some soreness in my bicep. That would be normal. With a bleed in the bicep, I might actually feel a achy, pulley stretch feeling when I go from a shortened position to a lengthened position. So when my arm actually extends, it might be an achy, pulley, strainy feeling as I open up. And then when I contract, it might not be super painful. It just might be a little achy, but when I go forward, there's definitely this pulley, achy feeling, especially when you're in one position for a while. And the reason for that is you have all this scar tissue and fluids coming into the area to try to stop the bleeding and clot it. And what that means when you go to move, it's sludgy and doesn't quite want to open up. So in terms of things you can feel in the patient, it is that feeling of malaise and fatigue, number 1 and 2. And then number 3 would be this achy, stretchy, pulley feeling when you are lengthening a muscle. So again, just to summarize those, on our front end of things, we've got the things that you can in fact feel or assess if you're a caregiver. And that would be things like heat, firmness of that area, and then of course the visual check of inflammation or swelling there. And then in terms of our physical, actual subjective feeling that you might have is that malaise and fatigue, and then that stretchy, achy, lengthening, stretch feeling when you are opening up a muscle that's just like doesn't quite want to move. So I hope that helps. I wish I knew a bit of that when I was going through my younger years, and helps us stay healthy, stay strong, and move a little bit better. So if this was helpful, please go down there and hit that like button and share it with folks that it might help. Until then, move like you mean it, and we'll catch you in the next video. All the best.